Good morning, and thank you for joining Senator Manchin's virtual session for West Virginians to give their input on what is needed for upcoming federal funding so that our state can recover from Corona. Today, 43 statewide organizations will provide a brief 1 to 2 minute update on their top legislative priorities. It is important for these updates to be brief so that everyone has a chance to speak and offer their perspective. After that update, all legislators have been invited and may make comments if time allows. As we begin, I would remind all participants to be respectful of each other's perspective. We have many diverse opinions represented on this forum. We only have 2 hours for today's forum. If you have a question or suggestion for Senator Manchin, please write it in the question and answer section of the teleconference. If we are not able to address your suggestion, please email it to common_sense@manchin.senate.gov. Every member of Senator Manchin's staff is listening today, and we are ready to follow up with you after this meeting. Now, I will turn it over to Senator Joe Manchin.
First of all, thank you all, and I appreciate it very much for you taking time to join us today. If I could ask all of you just to mute yourself right now, and that would stop some of the feedback that we have. This is a tremendous undertaking. The forum is going to help me identify West Virginia's priority as Congress considers the next Corona bill, and that'll be starting next week sometime. Before I begin, I have to tell you that we have been nearly overrun with really, really good legislative ideas since we published a flyer for this event from all across West Virginia and from every political persuasion. This is the way it should be. I've received ideas and listen, drive-through flu shots, elderly people saying, hey, I don't feel comfortable going into my doctor's office. Can I go and drive-through and the health department or wherever they go? This has all been very well received and they're processing it now. Ideas that improve the processing of unemployment claims and to help our workers who are caught up in the red tape, ways to improve broadband for our students, and all that are necessary for telehealth and everything else we count on. There's so many ideas for our youngest children who are in daycare. We're getting so many things that we need to be give attention to. I want to thank everyone who has taken their time again. Our state and nation continue to face both a healthcare and an economic crisis. And if this healthcare crisis gets away from us, I guarantee you, it'll be hard not having more of an economic crisis. So we've got to make sure our healthcare delivery system is able to handle what we are facing now. Our state has the 4th worst R0 value in the nation, meaning that we are transmitting the virus to each other at a higher rate than nearly every other state. So far, this nationwide this year, nationwide, 12 rural hospitals have closed. 3 of those are in West Virginia. That's 25% is right here in West Virginia. 3 of them have closed. Of the $175 billion Congress set aside for healthcare providers from the last CARES package, West Virginia had received less than 1%. On the economic side, our state faces a crisis that I fear we are only just beginning to understand. In the first quarter of this year, January through March, when most of the country was still open for business, West Virginia's GDP, or gross domestic product, declined by 5%. As of May, on a year-over-year basis, West Virginia's economy lost 91,400 jobs. That's a 12% decrease on net. With respect to local governments and economic impacts that are varied across the state, we know that cities which rely more on sales tax have been more immediately impacted than counties, which rely more on stable property taxes. But both are facing long-term funding challenges that could result in layoffs. West Virginia's general revenue collections were 35% lower in April than the previous year. And we're seeing new economic patterns emerging that are dramatically changing the way that businesses do business across the state. Steep decline in tourism has not only gutted sales tax collections, it has zeroed out funding for a lot of our convention and visitors bureaus, or CVBs, who aren't able to access the hotel motel tax funding on which they depend, and that's their lifeblood. Local businesses that are struggling to keep their head above water are pulling advertising from local broadcasters and newspapers, which is impacting their ability to continue operating. As Congress gets back into town next week, the focus will be on the next relief package. And as a quick reminder, Congress has enacted a total of 6 bills this year in response to the COVID-19 pandemic. Altogether, Congress, out of those 6 bills, will inject about $3.5 trillion in the U.S. economy. And that adds about $2.5 trillion to our national debt. While the data is still not complete, what we have assimilated now, we estimate that about $2 trillion of that funding has gone out the door so far. House Democrats passed their version of the next relief package in mid-May. It was called the HEROES Act. It cost roughly $3 trillion and drew an immediate veto threat from the White House. But Mitch McConnell, the majority party in the Senate, the Republicans, under the leadership of Mitch McConnell, has said this week that he will unveil the Senate Republican proposal starting Tuesday. I can only tell you we've had no interaction whatsoever. It's a shame the way this function is in Washington that we're not working together. I'm imploring my Republican friends and colleagues, let's start talking and working together. This is what this is all about today. We have 43 organizations on this Zoom today that are going to give us their main legislative priority. I wish that we could give you more time, but it is so important to hear from a cross section of every part of our state. So I know you have to be succinct within a minute and 2 minutes to oblige everybody. I also hope this forum is helpful to all the legislators who are on the call. I truly believe in the 3 branches of government: the Constitution, democracy as we know it, the executive branch, legislative branch, and the judicial branch. And the legislative branch is where the spending comes from. That's where the people have their input. And not to have that is wrong on a federal level and on a state level. And we've got to fight back as legislators to make sure that you're representing your constituents and doing the job that you're elected to do. I wanted to be sure that every legislator, regardless of political party, was invited and given the opportunity to listen and learn. And we contacted all 134 of our state legislators, 34 senators, 100 House members. And if we have time at the end to speak, we want them to chime in and say what we can how we can help them at the federal level and what they are needing most from us to be helpful to them. As one of your senators, working with Senator Capito in Washington, I remain committed to working with my colleagues, all of them, Democrats, Republican, Independents, everybody, on legislative solutions to ensure that our state comes out of this pandemic as strong, if not stronger than before. So I've talked enough now. Now it is time for me to listen, and thank you. I want to know that we appreciate so much your time and effort you're putting into this. So may God bless each and every one of you. And now let's hear from our statewide organizations. First of all, we're going to be hearing from, do I have all this?
Danny Scalise with the West Virginia Medical Association.
Right, Danny Scalise from the West Virginia Medical Association. And Danny, you are up.
Thank you, Senator. I really appreciate you organizing this call. I speak to your office pretty regularly, so I appreciate the communication and the tone of the talk I had with your office during this time. I really think I need to say I don't appreciate certain national leaders that have attacked doctors during this pandemic. I want to say I appreciate all the doctors, nurses, and other healthcare providers that are working on the front line. Because we need to be brief, I sent you a letter yesterday that outlines in detail some of the priorities that we have, and it will mirror some of the things that you've probably heard from the AMA, specifically limiting liability for healthcare providers who are doing things that are the best practices as we know them. PPE has been an issue from the onset of this, and we worry that PPE might continue to be an issue. And I think the third priority I really wanted to mention was that 501c6s, like a lot of the organizations that I run and I see that are on this call, are not eligible for PPP funding. And we'd like to see that, so that we've lost a great deal of revenue too, because we haven't been able to have a lot of the types of things that we raise funds with outside of the dues for our organization. So we've had to cancel a lot of meetings. I know it's been a great deal of revenue that we've lost at the association as well.
Thank you, Danny. What's the greatest need you're going to have coming up for the next COVID's, if we could pinpoint that next COVID round of spending.
The biggest thing that I hear from our folks is limiting liability. They are worried about the liability they have during this pandemic.
Okay. The second person we're going to hear from, Julie Huron. Julie, you on?
I am. Hi there. Thank you,
Hi.
Senator Manchin. Thank you so much for including the nurses of West Virginia in this discussion.
Well, thank you.
You're welcome. As I have been reaching out to different nurses that we work with, both my board and a lot of the nurse leaders that we work with across the state, a lot of the safety concerns that we have with PPE are we're really looking at the research, and we're wondering if it would be possible to have OSHA get involved more with the safety and the efficacy of the reuse of PPE. That has definitely, there's been new research coming out with concerns being raised on that. So that is definitely one of the concerns that nurses have, is that reuse of the PPE. And the other aspect that I wanted, and I'm trying to be brief so everyone has a chance to talk.
Sure.
We're looking at where the nurses are concerned with the emergency leave portion of the CARES Act, where people can take time off to care for family, but that has excluded healthcare workers. And we understand that if nurses are needed to be working, we need that, but we also know a lot of nurses have been furloughed, so therefore they're not working, but they're still unable to, take advantage of that.
Yes. Well, let me, Julie, we appreciate so much. And let me just say this to all of you, because I think I skipped over. My second panelist was supposed to be Joe Lesnock, and we're going to go back to Joe now from the West Virginia Hospital Association. But Joe, before you start, I want to say this. I have my entire staff on. That's all my staff here in West Virginia is on, all my staff in Washington, D.C., and also my energy staff on I'm ranking member on Energy Committee. They're all on. So they're taking detailed notes of each one of you all, speaking of what your concerns are, and we will be keeping in contact, and they'll be able to get back with you on some matters if you have questions to us or some suggestions you've made if we're able to fulfill that. So we want to thank you again for that. But Mara Boggs and the entire staff, DC and West Virginia, did a tremendous job of putting this together, and I thank every one of them. So we have every one of our staffs from healthcare to education to industry to banking. We have it all. So thank you all. And now, Joe, I'm so sorry. I kind of skipped over, buddy. So from the West Virginia Hospital Association, Joe Lesnock.
Thank you, Senator. No problem. I'll be quick, just like the others. I want to echo what Danny said about the liability issues. I'll flip the order, but the liability issues, if we can get them in the next COVID bill. And secondly, the C6 Association being left out of the PPP, we also were hurt by that. We were told the best you can hope for is to get it in the next COVID package. Secondly, as far as an issue on the CARES Act, which was your first question, the big thing we see there is there's money left in the remaining funds. And I think it's about $60 billion that has not yet been allocated to the hospitals and other providers. And so maybe that's a good thing since COVID is still going, but it looks like it's a problem with getting those dollars out. And secondly, on the accelerated payments that the hospitals were able to apply for, there was a 10% interest rate that's being charged for that money. And we've talked to CMS about that. We think that ought to be modified if it can. And secondly, if it can be converted to some type of, with COVID extending, if there can be some type of forgiveness or loan relief tied to some of that. I'm not talking about a blanket relief, but as COVID continues and revenue is lost, it's going to be harder and harder to pay those dollars back.
Thank you, Joe. I appreciate it very much. And Audrey's on the call, our healthcare person from Washington, and she's be right on this, and we'll get back with you all to get more details on it. Our next panelist is Sherry Farrell, West Virginia Primary Care Association. Sherry, you there?
I'm here. Thank you, Senator. First of all,
Sherry, let me just say one thing. People are starting, I'm getting some pop-up emails here. If you're having a hard time hearing, as people have said they have a hard time hearing, we seem to be having everything fine on this end of it. If you're not, send us something, we'll go from there. But Sherry, go ahead and get started. I'm sorry.
Sure. No problem. Thank you. First of all, I would like to thank you for your continued support of our community health centers. You and your office have been tremendous allies in the battle against COVID, and we appreciate your continued support. As you know, health centers have been providing testing support and have been responding to COVID since it began. The direct relief funding and the ability to provide telehealth services were a true lifeline, not only to our patients, but to health centers alike. We have a continued issue that telehealth is only temporary for community health centers. We need telehealth to be a permanent fix for us so we can continue that. We're constantly worried, when will that rug be pulled out from under us as patients are still seeking services through that modality. And the direct emergency funding was crucial to health centers. And we still need that direct funding. We have no direct financial support from the state at this time. So those federal dollars are literally what has kept our doors open. So for us, and I agree with my colleagues, PPE is still an issue along with some other items, but for us, that direct emergency funding and telehealth are critical.
Thank you, Sherry. And I can't make excuses for why the state hasn't distributed the 1.25 billion, basically concerning the healthcare. That's what it was sent to every state for. So hopefully you'll stay on top of that. And from the state legislators, I hope they'll pursue that for your sake and all the constituents. Next, we have Marty Wright from the West Virginia Healthcare Association. Marty, you on?
Hope you can hear me now. There we go.
There he is.
Morning, Senator. There we go.
Thank you.
Morning, Senator. Thank you so much for this forum. I'm still the relatively new exec at the Healthcare Association, which represents the nursing homes and assisted livings in the state. With respect to your particular questions, I really want to strongly push for at least one aspect of that HEROES Act that's coming over from the House, and that is the provider fund. I think it's about $100 billion that's been allocated and specified, which kind of dovetails off what Joe was talking about. Those funds have been very instrumental in helping us do the testing, trying to obtain PPE, and keeping these providers afloat. One thing for definitely seeing is the need for testing. West Virginia, you can take some pride in, has been the leader for the testing, especially on the long-term care side. And those funds that are allocated in the provider fund and possibly from this HEROES Act coming your way will help provide the testing that's going to be necessary to fight this fight. Lastly, just want to continue to echo the need for continued PPE. The shortages are real and are out there. And then the necessary immunity protections that have been floating out there are definitely going to need to be continued in part of this next COVID battle. But really appreciate everything you've done. I'm still relatively new, but you and your office, especially Mara, have been terrific throughout this and reaching out and finding out what the needs of our seniors are and how we can best impact everything. So thank you for everything you're doing and keep up the good fight.
Well, Marty, nothing like starting under the baptism of fire, that's for sure. I think it's fair to say that basically all of you are seeing an uptick in cases in West Virginia, and the way things are going, we're just concerned that we're going to be able to meet all the needs out there. So I'm anxious to hear about that also. Next of all, we have Richard Stevens from the West Virginia Dental Association. Richard, are you on? You there, Richard? There, we got you, buddy. Okay.
Hey, thank you, Senator. I appreciate your calling this people together. I too want to stand the need for the limited liability that was mentioned earlier by other people in the audience. In relation to the dental services, dental care in our state, I'm sure realize there was a significant period of time, almost 2.5 to 3 months, dentists were unable to practice, provide services to their patients because of the COVID pandemic. We had problems with the insurance industry, quite frankly, Senator. The insurance industry continued to charge premiums during those periods of time while there was no services being provided. We suggest that the insurance industry resolve this financial dilemma that has occurred. Also, in regards to the CARES Act, looks like Congress is putting that package together. We're hopeful for additional funding to, number one, provide tax credits to small businesses in our state to purchase the additional personal.
Hey, Richard,
Yes.
excuse me, this is Mara. We're having a little bit of a hard time hearing you, so I may need to get your concerns in writing so we can pass those on and get them in the bill next week, try and address them there.
All
Okay?
right.
Okay,
Sure.
I'm sorry about that. Thank you, Richard.
Okay, can you all hear me now? Everybody hear me okay?
We can hear you, yeah.
Well, we have Bill Kearns on behalf of the county health departments, and I've been very much concerned about our health departments being adequate. Bill, are you there?
Yes, sir. And Senator, I appreciate you and your staff taking the time so you can hear all of our concerns and requests today. I come to you on behalf of all 48 local boards of health in West Virginia. We're some of your ground workers. We're addressing this COVID-19 with every bit of passion we have in us. We certainly have seen our share of losses and revenue over the years. But in this pandemic that we're dealing with, we've experienced losses of over a couple $1 million in health departments between extra staff time and overtime and loss of revenue from programs we had normally received. We have about almost half of our health departments that currently have less than 90 days worth of cash on hand to be able to operate. Some of that has come from reductions that we saw a couple years ago in our we lost 0.25% of our state money through reductions at the state level, and we did receive some of that back in last fiscal year, about 12.5% of that lost back. We did. But the biggest concerns that we have right now, again, as I mentioned, we've expended over a couple $1 million. We are receiving some funds back now from the CARES Act funding. So appreciate everything that's happened with that on your all's level and what you've had to do with that and being our advocate for local health. We need infrastructure building. We need to be able to handle this pandemic or any other pandemic that may come our way. We need to be able to have staff on hand, not scramble at the last minute to try to hire people. It's kind of hard to hire somebody in the middle of a pandemic. It's not necessarily a job benefit that they're looking for, but we look for having funding that's stabilized to help build our infrastructure in our health departments across the state. We've seen some reductions because of where we've had to focus our energies on with our limited amount of staff. We've seen some reductions, certainly within the immunization programs, and even worse, we've seen reduction in our harm reduction programs. So when we're out there looking at this opioid problem that I know you've been a champion of helping to get running, you've been here in Martinsburg with us, and we're trying the best we can, but still our energy, we have only so much of our staff time that we can focus in different areas. So it's all more important that we look at getting stabilized funding, that we get additional funds that come down to your local health department personnel. And as we look, we're just 2 short months away from our normal influenza season when we start getting our boots on the ground for getting vaccination clinics. We're still going to be in the middle of this pandemic while we're trying to also vaccinate people for influenza. So when we have limited amount of staff, it makes it so difficult to be able to try to address every need of our community with limited funds and personnel. So anything you could do, sir, I would greatly appreciate it on behalf of myself and all the rest of the health departments in your state.
Thank you, Bill. Appreciate it very much. Our next person is going to be Dr. Scott Davis, Physical Therapy Association of West Virginia. Scott?
Thank you. Yes, thank you, Senator Manchin. I just wanted to let you know that most physical therapy practices are operating at about 60 to 80% of the pre-COVID levels. So they are struggling financially. And the biggest concern that we have right now is that the additional 8% Medicare cut is going to really make this unsustainable for some practices. So we would like to see the 8% cut be addressed. And then, like others, we would like to see telehealth become permanent and extend beyond the current crisis. So those are our two big issues.
Thank you, Scott. And let me just tell you about the telehealth. We are fighting, and now this has shown the increase of attention that we need, and also being able to get high-speed internet all over West Virginia. Rural America does not have connectivity. That's what we're fighting for. And this COVID has shown the desperate need that we have. And it's a must for all of us to be able to succeed. Now, with the new normal being abnormal, it's more imperative than ever before for education, for healthcare, for everything else that we depend on. So thank you so much. Our next presenter is Dr. Michael Roby. He's with the Osteopathic Medical Association of West Virginia.
Thank you, Senator Manchin. I appreciate that. Actually, one of my first topics was what you were just talking about was telemedicine. And particularly in our rural areas, we've noticed, as you mentioned, a huge concern with connectivity with our patients in those facilities, the inability to be able to do video visits and being focused on just audio visits. Trying to touch on a couple points that maybe others have not brought up in the healthcare world. We're going to face an issue real soon with remdesivir and the reimbursement for remdesivir. It's a very expensive medication, and at this time, with only an emergency approval from the FDA, payers are not willing to compensate for remdesivir. So that's going to be one issue. And then I think a third issue was some of the issues that we're having with the skilled nursing facilities being able to accept patients in a timely manner has led to kind of a backlog into the hospitals. And I think, hearing from some of our rural physicians, if there was a way to start looking at whether Medicaid funds could be used for swing beds in some of our rural access hospitals, I think that would be something that would be advantageous to our rural communities as well. And thank you, Senator, for listening to us today.
Okay, thank you, Michael. I appreciate it very much. Now we're going to turn our groups to represent our local governments. And first we have Jonathan Adler with West Virginia Association of Counties. Jonathan, you on?
I'm here, Senator. Can you hear me?
Great, I got you. Loud and clear, buddy.
All right, great. Thanks so much for this opportunity. I think we have 3 or 4 points that we want to get across as far as local government's concerned. One, as you know, right now, property taxes are our main source of revenue. We've seen stable revenue from property tax, so they haven't been impacted, but we're certainly worried about the future. In the future, in case the economy really falls and we see the failure of businesses, which would result in job losses, people having to move, so you're losing residential property tax, you're losing business property tax, things like that. So we're worried about the future funding, future relief, that will be there in case that does happen. Secondly, we talk about revenue loss and recovery. Right now, the CARES Act does not answer to lost revenues. An example of that would be counties have seen hotel, motel tax losses, and certainly tourism and travel has been hit very hard. And so how do we, first of all, they need relief and help, but we need revenue recovery from that, as well as helping them to recover themselves, finding a mechanism to maybe give them some relief from us with recovery. Thirdly, there's direct payments that counties have not received. That's something the National Association of Counties had fought for. As you know, the monies went straight to the governor's office, and we're now applying to the governor's office for those CARES Act monies. It's a burden on the counties to have to spend time to apply for those monies. They're unsure how to do that, and direct payments would certainly be helpful in the future from the federal government. And kind of tied to that, Senator, is the fourth point, and that's having clearly defined across the board guidelines from the federal government. Everybody across the nation, all the states have defined this differently. There have been 4 or 5 iterations of FAQs distributed by Treasury, which has just added to confusion. The governor's office is confused. You are confused, I know. We've talked about law enforcement budgets being covered. So how deep does that go? Other states define that differently as to how far you go to take care of the budgets for law enforcement. So there just needs to be clear guidance from the administration in Washington to make sure that everybody's doing this correctly and that there's no legal issues down the road. That's another fear counties have, is down the road there could be a federal audit if maybe they're spending the money incorrectly or illegally. So that's a fear too of why counties haven't applied like maybe they need to.
Well, Jonathan, thank you. The only thing I can say to that is that we've tried to be as clear as we possibly can. We know that from March the 1st of this year of 2020 to December 31st, every state that received money, the $1.25 billion that went to the state of West Virginia and all the smaller states, was supposed to be reflected to coronavirus expenses. And it's pretty clear about that. And the health departments, everyone who hasn't, and all the counties and all the cities that have lost because of their 911 cost or basically first responders, all that should have been reimbursable. So keep plowing away. Hopefully we can help you and hopefully that this will change. Next is Jennifer Percy with the County Commissioners Association of West Virginia. Jennifer.
Can you hear me?
And gotcha.
Okay. I just want to reiterate everything that Jonathan said. He and I basically have been working in tandem since March when all of this happened. And the biggest thing that I see with my commissioners is with the CARES Act monies, not all counties have staff who can write grants and apply for this funding every single month. And it's been very frustrating because literally our commissioners and our county folks are just fighting to keep their doors open and provide services. And I just want to say, thank you again for the invitation to participate in this and to be able to share our thoughts.
Every county, West Virginia, you're going basically to the governor's office to apply for this. I can assure you that will never happen again as far as the second round. If there's money attributed to states and counties, the counties will go directly to the counties. The states must pass it on. They'll have no discretion whatsoever. The third person we have in this topic is Susan. I'll make sure I get this right. Susan Okononomu, our municipal league. Did I get it right?
That's good. Thanks, Senator.
Close enough, Susan.
You got a lot closer than a lot of people do. You did well. Thank you very much. And thanks for having us on this conversation today. We are all in this together. It's good to hear the views from all the other different organizations that we're all trying to work together to address this. The city's concerns are much like the county's concerns. We have gotten some money from the CARES Act, but of course that's all related to expenditures and it's not helping with revenue shortfalls. So cities are looking at cutting back on services or cutting back on personnel, and they don't want to do that. In certain cases, they can't do that. So a solution to revenue shortfall and more flexibility with how that money can be spent. Every city has a different need, and for them to be able to figure out where they want to channel that money would be very valuable. Also, the accessibility, any direct disbursement is better than funneling through the state, and I understand the administrative challenges of that. But if it has to go through the state with some very clear demarcation about where that money is to go and how much is going where, would be helpful. And also, we don't know how deep this well is yet, and we're concerned that a year from now, there will be things we haven't thought of yet that we'll need aid for. So a package that would span more than just this year or the immediate future would also be very helpful to municipalities. Thank you.
Thank you, Susan. Let me just say that's exactly why the legislators have been so keenly interested and wanting to be involved in this process, and they should be involved in this process. And I hope they continue to make their noises and their voices heard. Next, we're going to hear from a group representing our first responders. And first up is our friend Rodney Miller with the West Virginia Sheriff's Association. Rodney, I know you're on.
Good morning. How are you?
Fine, my friend.
Good. Thank you for bringing this together. And I know that from looking at the list, I'm probably the only law enforcement representative that's on here. So what I did is I went out and polled deputy sheriffs, fraternal order police, chiefs of police, other law enforcement groups to kind of to go along with this law enforcement part of this. And I'm hearing the same thing mostly from all of them. A lot of it comes down to personal protection equipment, filtering down, getting to law enforcement, even as much as down to the possibility of PPE, physical barriers, even into the tax office, the laundering of clothing that these officers are wearing, because as you know, in a bad circumstance, there is no real barrier other than the law enforcement officers having to get physically involved with some people. So in addition to all the PPE, funds to cover salaries, at least a portion of law enforcement salaries, some of which overseeing prisoners, transports, video arrangements, mental hygiene, just to name a few. Some of overtime for officers that have to fill in for other officers that have tested positive, which creates a shortfall of already understaffed law enforcement in the states. And then secondary to that, and not really secondary, but often not thought of, day report centers, drug courts, home confinement, probations. They need the same type of care, concern, and funding as law enforcement and other parts of the system, because once the criminals, or the clients, if you will, come into the system, they're not being put into the jails, obviously for the COVID concerns, but they're going to alternative sentencing, and then they're coming into facilities that the sheriffs, primarily with some of those, are having to deal with, and coming into a protected facility, if you will, not knowing where those folks came from and what their exposure is. And a lot of that goes along with decontamination efforts in an effort to try to keep cars, equipment, facilities, things like that decontaminated. And you know, it has to be burdensome on our friends from other county offices, and especially the county commission, trying to put money forth and do the best they can to continue to provide services, and ultimately in dealing with the public and the most visible part of government, those guys driving up and down the road with reflective lettering on the side of their cars. Ultimately, we don't want those to contract something and then pass it on to their families and other community members. So that's just some of the concerns, and we can go into more detail in writing later with Mark.
Rodney, I want you to know that all of us in West Virginia support our law enforcement officers. They do a fine job, and we're very, very proud of them. Next of all, we have Chris Hall from the EMS Coalition of West Virginia. Chris.
Thank you, Senator. In recent weeks and months, the hospital closures across West Virginia gained a lot of attention, but kind of overlooked in those discussions is we've had more than 70 ambulance agencies across West Virginia close over the past decade plus. And this COVID situation has really compounded the financial struggles of these agencies. And right now, where our greatest concern is the aid packages being developed are not reaching all of our state's ambulance agencies. The aid is being directed through local governments such as cities and counties frequently. And really, a minority of West Virginia EMS agencies are formally affiliated with a political subdivision. You'll see agencies out there with a county EMS squad or a city EMS squad put on the side of their truck, but they're really a private or nonprofit organization and don't have any formal relationship with those political subdivisions, and they're not receiving access to these funds. So we'd like to see Congress develop a mechanism for distributing the future relief funds directly to all EMS agencies and not need that affiliation with the political subdivisions, where we're seeing a lot of the funds get held up at the state level and then directed back into the cities and counties. Another issue that we have through this is ambulance agencies only get paid when they transport a patient. And we're seeing a lot of patient refusals for transport right now because they fear being transported to those medical facilities because of COVID exposure risks. And so some of our squads are reporting that they're seeing 40 to 50% of their calls turning into refusals at this stage. So we would like to see Congress direct CMS in some capacity to reimburse ambulance agencies for providing treatment in place. Not only is that the right thing to do for the patient in order to care for them and make sure that they're not getting transported to the hospital, ultimately there should be savings produced there by making sure that they're stable and cared for if they do not have the need to go to the hospital. And then finally, the topic that I would add to the discussion is EMS agencies are unique compared to a lot of other healthcare providers in that we aren't operating in a controlled environment. We're not in a clinic, a hospital. We're going into people's homes. We're providing care at the scene of a wreck along the side of the road or other public areas where, you know, it's more difficult to maintain that environment and prevent the spread of COVID. So we're really concerned, just like the Medical Association, the Hospital Association, Healthcare Association, Dental Association, about the potential lawsuits and liability related to COVID. You know, our healthcare heroes should be focusing on lives, not lawsuits. and we hope that Congress will look at some ways to protect them from that.
Thank you, Chris. Appreciate it very much. Next, we have the West Virginia Troopers Association, Greg Baker. Is Greg on? Greg, are you there? If not, I know he's been running back and forth on call, but if he's not, we'll come back to Greg. Greg, one last chance. If you're not there, you tell me when you are and we'll come back to you, okay? Thanks, Greg. We'll get Greg later. Next of all, we're going to go to our workforce, people who are representing the workers of West Virginia, who are on the front line, unemployment, and the challenges they have with the economy, their concern and their jobs and livelihoods. So first of all, we have Josh Shore with AFL-CIO. Josh, are you on?
I'm on, Senator. Thank you for having me.
Thank you.
Let me just cover the 5 economic essentials that our national organization, just to reaffirm, I know you've already heard about them. Number 1, keeping frontline workers safe and secure, personal protective equipment, training, testing, all those things. 2, keeping workers employed and protecting pensions. You know, we have 30 million Americans who rely on a pension that could be at risk here. We need to make sure we protect those. I also think that we can do a better job with unemployment. There was a bunch of red tape the first time around. I think we can do a better job so that we're making sure that those that need unemployment benefits can get them. Number 3, keeping state and local governments, our public schools, and the Postal Service solvent. Explanation needed on that. Number 4, keeping America healthy by protecting and expanding health insurance coverage for West Virginians and Americans. Too many people have lost their jobs and their health care coverage becomes at risk at that point. And number 5, the time is right for infrastructure. We can put people back to work building our schools and our hospitals, our transportation and telecommunication systems. I think that should be included in this next package. Lastly, I want to go back to something you've referenced a couple of times, and that's the $1.2 billion that Congress appropriated for West Virginia. There should be legislative oversight on those federal appropriations that go to the states. Our system of government doesn't work well without checks and balances at the state level. So anything that Congress can do to help with that would be greatly appreciated. And other than that, appreciate the opportunity to be here, Senator. Thank you.
Thanks, Josh. Couldn't agree more. And that's why we have our state legislators listening in right now. And hopefully we'll hear from them later. Next of all, we have Mary Chips, the West Virginia Community Action Partnership. Mary, are you there?
Yes, I'm here. Thank you, Senator.
Thank you, Mary.
I appreciate the opportunity to be on the call this morning. I represent the 16 community action agencies in West Virginia that work with low-income individuals and families. Can you hear me?
We can hear you. Yes, we can hear you, Mary.
Okay, I'm having issues with the internet here, so I want to make sure you can still hear me. As I said, I represent 16 community action agencies in West Virginia that work with low-income individuals and families, and we are very appreciative of the $11 million in additional community service block grant funds we received through the CARES Act. However, there has been delays in getting that funding to the community action agencies, first with the Office of Community Service, and then through the state. So they're still waiting on reimbursements of funds for money they have spent. So we would like to see something in the next HEROES Act or CARES Act package that addresses the delay of the funding getting down to the people that are actually doing the services. And the last thing that I'd like to say is that we're really concerned about the moratorium that's been lifted on utility shutoffs, and especially with regard to water assistance, because there's really no specific agency that addresses water issues in West Virginia. And we feel like that our agencies are going to be the ones that are going to have to step up and help those individuals with shutoffs from water bills. Thank you.
So much, Mary, and I appreciate it, and we definitely look into that. I thought PSC had oversight on all that, and I will double check to make sure, but we'll get back to you on that, okay? Next, I think Greg's back with us now. Troopers Association, Greg Baker. Greg, are you on?
Yes, sir. Thank you for having me.
Oh, thanks, Greg. Appreciate you.
Senator Manchin, I just want to say that the West Virginia State Police continues to provide service to the citizens of West Virginia with no left in service. We're protected by our PPEs, and we continue to be the front line in protecting the citizens of West Virginia. And anything you can do to help us fight that fight, we'll be happy to have.
Absolutely. We appreciate it. And I said before, Greg, we appreciate it. We really thank all of our law enforcement for the job they continue to do in most difficult times. But thank you. And we'll be there for you and be behind you. And we have all our legislators on the phone, 2 state legislators, which I know feel the same. Next of all, we'll go to our bank. Go ahead. I'm sorry. Go ahead, Greg.
Thank you, Senator, and continue to do the fine job you're doing.
Okay. Next of all, we have the banks and financial institutions. They've played a vital role through the pandemic, especially with the SBA's PPP, Paycheck Protection Program, and beyond. So first, we're going to hear from Mark Bias on behalf of the West Virginia Bankers Association. Mark, are you there?
Yes, sir. Thank you, Senator.
Yes, sir.
I am, as you say, representing the West Virginia Bankers Association today. I'm also president and CEO of Premier Bank. We participated as a group, both at my bank as well as an organization, very actively in the PPP program, which we believe was an outstanding program sponsored by the federal government. In our case, and in many cases, it did exactly what it was intended to do. We made at Premier Bank 1,100 loans totaling $90 million, an average of about $90,000 apiece to small businesses in West Virginia and surrounding communities in which we're involved. And what we've seen happen is that the requests for PPP have dropped off considerably. And what we interpret this to mean is that the small businesses that needed the funds have gotten them already. What is missing at this point, though, is what I'm going to call a second round of funding, because this has endured a lot longer than we thought it would. As you know, the loan calculation was based on 2.5 months of payroll. Well, we're beyond that period now. We're into the next 90 days or beyond of COVID. And so what we anticipate is that our small business constituency is going to need additional funding in order to keep themselves afloat. Small business is incredibly vital to the U.S. economy and to our employment base. And we think that they are in serious need of additional help in this regard. On the other hand, the forgiveness process has been elusive. We haven't yet had that communicated to us. I mentioned that we made 1,100 loans at our small bank, and we are responsible for calculating the forgiveness calculation for each one of those, a tremendous amount of activity. So what we would ask for is a simplified process. Indeed, we would advocate that we have basically an affidavit that the monies have been used as intended for loans under $150,000 and that forgiveness be granted based on that, as opposed to some lengthy calculation process. We do believe, based on experience, that the loans have largely been used for exactly the purposes that they were intended. I would also just touch very briefly on the Main Street program. And I would suggest that the rates are really too low in that program for many banks, like community banks, to be interested. LIBOR 300 as of today is about 3.25, 3 1/8, very, very low. And so what we would suggest is that rather than the government lending the money with us selling a 95% participation, that we be the lender and the government give a credit enhancement, and then we can price it very well. With this kind of pricing relates to the risk. The credit enhancement would be much more valuable, would keep us in the game, and we're the underwriters, we're the lenders, and we think it would that the program would be better if it were structured in that manner. The last thing I'll mention is that we need ongoing support from the FDIC for a great number of payment deferrals that we have been requested to provide by our borrowers. So many of our borrowers have requested 90 days and more of payment deferral. We need that to be supported by the FDIC and not be criticized for that as we move forward into bank examinations. Thank you very much.
Hey, Mark, thank you for that extensive, and it was very, very detailed, and I appreciate it very much. Also, there's about 100, our calculation is about $100 billion left in the PPP program, so we're going to be getting more accountability on that this week. Next of all, we go to Donna Tanner, Community Bankers Association. Donna, are you there? Donna Tanner for Community Bankers Association. Donna, maybe unmute and see if you can get in with us. If not, we'll go to Rich Schaefer, and then we'll come back to Donna once we get contact with her. Rich Schaefer with the West Virginia Credit Union League. Rich, are you on?
Yes, Senator. Thank you for the invite. You can hear me okay. And I just wanted to mention thanks to your staff for being very proactive during this whole pandemic. It's just been very helpful. As we look ahead to the Phase 4 CARES Act legislation, I just want to let you know that credit unions are fully committed to helping their constituents throughout this pandemic. With specifically, and PPP was mentioned, credit unions have provided loans an average of $42,000. That's about $7,000 below the national average. So with that in mind, we would ask you to consider supporting S4117 or getting that rolled into upcoming CARES Act legislation, and that would provide forgiveness for loans under $150,000. That would be provided that the lender be held harmless for any enforcement action, and also that provided the borrower submits the proper attestation form. Also, if you could urge SBA to provide clear guidance on forgiving PPP loans, that would be helpful, and to support liability protection for credit unions and other lenders, helping the government implement the assistance program under clear SBA PPP guidance. Two other things, and I'll finish up, is if you could ensure that and clarify federally chartered credit unions could not be excluded from the paid leave tax credit. Federal credit unions are not-for-profit financial cooperatives under Section 501c1 of the IRS code, and are the only not-for-profit entities prohibited from receiving this relief. So if you could look into that. And lastly, we need your help in allowing remote notary and remove face-to-face requirement on notary services. So with that, thanks again for the invite.
Thanks for the input. Very, very helpful. Next, we're going to hear from our groups representing our business community. We're going to start with Steve Roberts. He's the Chamber of Commerce president. Steve, West Virginia Chamber of Commerce.
Senator, I'm here. Thank you to you and your staff and to all of those who are participating on this call. I've learned a lot, and I know we're learning from each other. And again, a great big thank you to you and your staff for putting this together. Since we just this instant heard from our bankers, I'll just follow up and say many of our small businesses are looking for clarity on the loan forgiveness program. And so kind of ditto to what they were saying about guidance needed on moving forward with the loan forgiveness program. The second issue I wanted to point to is, and while this is anecdotal, we hear it across the board, companies are ready to begin rehiring. It's for reasons that we think are fairly obvious. Employees want and need all of the benefits they can get. So we're looking for that happy ground, that happy medium between what employees need and can get and what employers need in order to be able to get people to come back to work. So we are hearing a great deal from employers who are saying, you know, I'm really challenged in getting people to come back to work. And that is not at all to say that we don't want a continuation of the PPP process, because we do, but we think a more happy middle ground needs to be struck that helps our workers who are in need, but also provides incentives for those who could go back to work to go back to work. We hear within our organization a lot about the 501c6 issue, as was pointed out by the very first speaker and several others. Many of us, perhaps most of us on this call, do represent 501c6 organizations, we were not able to take advantage of any of the majority of the PPP topic, and we have stayed open. We are providing information across the board, and we want to continue to do that. So that is an important issue, and I'm glad so many speakers have brought it up. Not only do we think that PPP needs to be extended, but we are interested in the employee retention tax credit. We've had a number of employers that have been able to get some relief via the employee retention tax credit. We think it was is useful, and urge consideration of extending the employee retention tax credit. A few others, and then I will wrap up. We're hearing from our colleges and universities that they depend heavily on having foreign students. The COVID crisis has obviously placed lots of stresses on many of our systems. But I just want to put out there for all of us to be aware of and think about that the international students help bring diversity to our state. They bring diversity that is needed in our state. They also help populate our campuses, and they bring needed funds to our colleges and universities and CTCs. And we want to we're not, this is not the appropriate time to say what all of the answers are, but we do want to point to the importance of the international students to help strengthen our state, make it more diverse, and help our colleges and universities. Liability protections, especially for healthcare providers, manufacturers of PPE, manufacturers, for instance, of hand sanitizer, small businesses that are doing their best to follow safety guidelines. We hear over and over and over from employers and small businesses that they really are trying to do the right things, and that they would like to have some assurance of liability protection related to doing the right things. We also, Mara, were you saying something? I'm sorry.
Oh, yes, Steve, could I get your considerations in writing?
Yes, absolutely.
Okay, great. Thank you.
Yes, thank you for asking, Mara, and the answer is absolutely.
Okay, great.
And we strongly support aid for child care organizations in schools. Our schools are feeling a lot of stress because our children and parents and families are feeling a lot of stress. We don't want to lose a whole year of learning. We don't want to do anything to cause us to lose a generation of children who rely on childcare, who need their schools, who need the support and love that comes from the teachers and the school administrators. And the schools simply don't have enough money. And we see a lot of federal money flowing. There's been much reference made to the money that our state has already received. Now we have to ensure that it gets to the right places. But I don't want to leave this conversation without saying many child care organizations are small businesses. Many people who work for small businesses, medium-sized businesses, and large businesses really can't work without access to child care, and the child care providers are under great stress. So I'm going to wrap all those things into a letter to you. Again, thank you very, very much for the opportunity to be with you. It's great to be asked. We appreciate being asked. And all of you who have spoken so far have provided very, very helpful information. So thanks to all, and stay well.
Thank you, Steve. Our next presenter is going to be Bridget Lambert with the West Virginia Retailers Association. Bridget, are you there?
I am. Can you hear me?
Sure can.
Thank you, Senator, and your staff for having us here today. Ironically, the number one issue that my small and mid-sized retailers have identified piggybacks what the West Virginia Bankers Association just relayed, and it is the Main Street lending program that's made up of 3 loan components. Retailers have had difficulty finding banks that will make these loans through the program because the credit subsidy is too low. And the retailers who are needing it most are being considered too great of a credit risk under the standards. And so that's one thing that we definitely need addressed for our small and mid-sized businesses. And regarding some priorities, I'm going to piggyback the other associations in reminding you the 501c6 organizations were left out. And we all have worked harder than we ever have before. Our employees are on the front line of this pandemic every day. Business liability protection regarding to the coronavirus is also paramount for us.
Thank you, Bridget.
Thank you, Bridget, so much. Next, we're going to have Joe Browse on behalf of the Economic Development.
Hi, Senator. We've been working with your staff day in and day out, particularly on these loan programs. They've done a magnificent job of managing the shifting guidelines and the zigs and the zags of that. So that's the response piece. And you've demonstrated and we've proven that we can do the response piece, and we'll continue to do that. I think you've alluded to the future economics of this. So if we can do response, then we can think ahead a little bit to recovery. So I want to echo some things that have been said previously, and that is that, you know, we're talking to site selectors, and we're hearing from multiple ones that say, hey, in the light of this tragedy, we're going to start looking to rural America, and again, to the opportunities that offers. West Virginia is a part of that, as we all know. We've got to be prepared for that piece of it. So what we're asking for is just, you know, whatever policy that you can look at, whatever advocacy that can come from your office with respect to the infrastructure that we so desperately need in West Virginia, with the site validation pieces. So we want to, all of us here at the local economic development level and the state want to work with you on those things. Maybe we can turn a lot of these challenges into opportunities. So thank you again for listening.
Thank you, Joe. Appreciate it very much. We have Troy on behalf of the West Virginia Manufacturers Association. Troy, are you with us? Troy Thomas?
Yeah, hi, Senator. Can you hear me?
And now I can, Troy. Got you, bud.
Okay, thank you very much for this. This is wonderful. Just a couple of brief points. Number one, we're so glad that Congress gave our employees extra unemployment support. They needed it. They deserved it. But the extra $600 plus state unemployment paid them more than $23 an hour, which is more than most of the associates earn here at work. So we had a lot of trouble convincing them to return to work. We also had to raise wages for the people who did remain at work by $5 per hour just to keep them here. And they were understandably jealous when we understand that. We lost 80% of our sales in April and May, and we couldn't afford to do that. So that's one concern. We paid $95,000 a month to continue health insurance for our people. That is not reimbursed by the retention tax credit. So that's a concern too. Secondly, the absenteeism due to the new leave benefits has tripled, and it's become a problem for our company. That's the paid sick leave and paid FMLA.
Right.
That's all my points. Thank you.
Well, Troy, let me thank you. And let me just tell you on the unemployment, I know that's been a concern. A lot of people, I think we're advocating basically taking a surgical approach to unemployment. The people that have lost their jobs because of a pandemic and basically a health concern, they've been shut down with no fault of their own, should be made whole. That means whatever their paycheck was, we make sure they get their paycheck. And I think that's the approach we're going to be able to take, hopefully anyway. So I hear you loud and clear, and I appreciate your input. Next, we have Stephen Butler from the West Virginia Farm Bureau. Stephen?
Yes, can you hear me?
Sure can.
Thank you, Senator, for having us on. We appreciate that. And as far as the agricultural community is concerned, one thing that you already touched on is the rural broadband. It's a big issue for our rural members across the state, whether it be their children, and if the schools now was online this spring, you know, many of us suffer from having rural service for broadband. As the farming community gets more technical, you need that to work on the machinery now, and it's a big issue even without the pandemic. And also, we want to say that the CFAP program in the first round has been working. many producers suffered due to the slowdown in the processing facilities being out in the Midwest. Cattle prices dropped drastically. Of course, the meat prices in the store went up. There was a wide spread between the product going into the plants and what came out of the plants. The box beef was much higher. Just if we could make sure that there's not advantage being taken of the producers. The profit margin on the farm has continuously dropped over recent years, and it's starting to take a toll on many producers or whether they want to continue. So we can't afford that in our state in agriculture. And I guess one thing that we have suffered from is the processing facilities. Many of them have foreign control now. And it's concerning in our country. So
Very much so.
Thank you for allowing us to be a part of this.
Absolutely. A big part of it is fed. Next of all, we have Adam Grayson on behalf of the American Institute of Architects. Adam, you there?
Yes, good afternoon, Senator. Can you hear me?
Yeah, I can.
Excellent. First of all, I'd like to thank you for setting up this forum. It's really been excellent to hear from so many people and for the work completed on COVID relief to date. Our membership is comprised of individual architects, but many of the firms that employ them have been able to access the PPP funds, which has really helped to stabilize employment in our industry. So thank you for your work on that. On behalf of our members, there are two additional items we request your focus on moving forward. One is a little bit redundant. You've heard a lot about it, which is access to PPP funds for association management. Organizations like the West Virginia chapter of the AIA or 501c6s that are not eligible, but they've really been critical during the time of COVID relief with services including continuing education, critical to licensure, business and career resources, advocacy for building energy and environmental codes, et cetera. And as you know, many of these organizations are funded through dues and events, both of which are really suffering at this time. The second issue is related to long-term relief. Design and construction account for 4 to 6% of GDP, and there's a concern that the pandemic is going to shift resources away from addressing these existing infrastructure needs. And this includes the need to fund improvements to public buildings, such as the more than $5 billion of need that exists to improve public school facilities in West Virginia. So we'd like to ask that you please consider additional investment in this critical infrastructure and any future relief packages. And thank you very much again for your time today.
Okay, thank you, Adam. The senator had to step away for just a minute, so I'm going to introduce Carol Fultz with West Virginia Hospitality and Tourism Association. Carol?
Hey, Mara, thanks for the opportunity today. We appreciate the senator and yourselves taking care of everyone as you have through this whole pandemic. I'm going to echo the comments on the unemployment compensation. It is still really a real problem for the tourism industry. We still have in our larger businesses 30 to 50 employees not returning. In our smaller businesses, we have 3 to 5 employees not returning. And, you know, that cost comes to us too, beyond them. But the other piece that we're really concerned with now is the FFRCA, which is the Families First Coronavirus Act, which is now obligating, you know, the unpaid sick leave up to 80 hours, and that's really hurting an already challenged industry. So that's another piece we're having a hard time with. The work bonus piece that you all have been discussing would be helpful if we could look at that additionally. I think that helps. We just need some return to work incentives. I mean, we really do. Assistance with street closures would help. Maybe if you could close the streets for those venues for restaurants and, you know, entertainment and event, we could hire more staff and use more staff. So that might be another opportunity in that realm. That's still our big piece. The Main Street lending program is just not working. I know that's been talked about, but what we're finding, the big requirement there is the problem with having to have liquid assets as a collateral to get the loans. I mean, we're already hurting, and I'm sure everybody's put up about as much as they can all put up, and that's a big piece. The business interruption insurance on that front, if there's anything to be done, I know that we've all discussed that. Liability protection for COVID related. And we didn't know if there might be a possibility of tax credits for PPE costs.
Okay, thank you, Carol.
I have others. I sent it all to you. Thank you.
Okay, thank you very much. We take it all. And our
Okay.
staff has already been reading your letter this morning, so thank you. And the
Thank
senator
you.
will join back in just a minute, but let's go ahead to go to Chris Richards with the West Virginia Convention and Visitors Bureau. Thank you, Carol.
Thank you, Mara, and thank you to the senator and all of you for all the great work you do for our state and for tourism in our country. It's amazing what you all have accomplished. As you know, tourism is an economic driver for the state of West Virginia and all states, and we are the community's resource to advertise and promote that tourism. That being said, we live, as you know, we live off of the hotel motel taxes, which have completely, almost totally dried up due to the state closure and the pandemic. So our revenues have been extremely hurt. I'm going to reiterate that we were excluded as 501c6s and some of the quasi-government groups from the PPP program. So if we could get some help there, that would be great. And as the senator mentioned earlier, we also are having issues with the loss of revenue as far as advertising. I mean, we can't advertise if we don't have the money to do so. So any help you could give us in that aspect would be greatly appreciated. And lastly, I think with CVBs, our biggest challenge is the loss of revenue because, as you know, as we bring visitors in, that's going to help with recovery. And when we can't advertise and we can't promote, recovery is going to be twice as hard, especially in West Virginia. And I'll just conclude with thanking you all for everything you do.
Thank you, Chris. Thank you for everything you do. And Kelly Collins with the West Virginia Association of Fairs and Festivals and also the CEO of the State Fair.
Good morning, and thank you guys for listening to me and our organization over the last few months. I really appreciate it. I agree with a lot of things that have been said, especially with the PPP. It's a great program, but a lot of our members are 501c5s and 6s. And then for those of us who did get that, just the forgiveness side of it. You know, our events have been rightfully canceled this year. We understand why we had to cancel and understand that, but our chance at funding for the year is completely gone now. So on the lost revenue side, I know the economic injury disaster loan, you know, there's a cap of 150 right now. So the avenues for us to receive any type of help are very limited at this point, and we don't even know where to look now.
Thank you, Kelly, and we'll continue to work with you and all the fairs and festivals over the coming months.
Sure, thank you
so much. And let me just say now we're going to go to our veterans. And first of all, I just want to say with what we know about the VA and what's happening and unfolding there, my heart still goes out to every family, and I know that every one of you all feel the same way. But we will get more answers for those people that still have concerns, and we're going to make sure that we finish doing it and make sure this never happens again. So with that being said, we want to bring on with Karina Bogus with the VFW. Karina, you on?
I am, sir. Thank you for taking the time today to address some of our concerns. As far as the veterans and the CARES Act, I believe about $17 billion was allocated to the Veterans Affairs for telehealth, expanding the telehealth program. My understanding is, as part of that money, they used to purchase about 5,000 tablets that they distributed in about 86 healthcare systems across the country out of 103. And I don't know if West Virginia is in that pool of getting those. And 5,000 tablets is really a small number when you consider how many veterans that we have. My understanding is they prioritize those tablets, distribute them to those veterans who are in palliative care or oncology and what have you. So when you start talking about telehealth and with the broadband connection issue that we've already addressed, you're really talking about a telephone call. And so what happens is the veteran gets a telephone call and they answer a few questions over the phone, and then they're told, hey, I'll see you in 6 months or maybe a year. And that's actually very disconcerting for veterans, especially those that are under some type of a specialty care for an unstable condition, whether it be diabetes, especially with our Vietnam veterans. And then our veterans who have mental health issues. I mean, if you're taking a phone call for a mental health issue, yes, in a crisis, that might be helpful. But for stabilized care, we need to find a better solution here in West Virginia than a telephone call. In addition, because of the community care program, MedExpress is now available to the veterans. However, we're actually being limited in how much we can use that MedExpress for, and it's usually a cold, flu, poison ivy, or what have you, and we're limited to 3 visits a year. And then after 3 visits, if you go back for that 4th time, you're going to be paying a $30 copay, regardless of your priority group.
Hey, Karina,
Yes.
I'm very sorry to interrupt you. This is Mara. We'll have to get the rest of your comments in writing, and if everybody could just kind of keep to one thing that went wrong in the CARES Act, and then one future priority that you have. Thank you, Karina. I'm sorry to interrupt you.
Yeah, the only thing I asked is maybe just waive the $30 copay and the limit, and then try to get back to face-to-face. That's what veterans want. They've done surveys. That's what veterans want, understanding the safety distancing and the masking. So I was just about finished. I had half a second.
Great input, Karina, on that, especially on that. We can get right on that one, too. Next, we're going to hear from our dear friend Owens Brown from West Virginia National NAACP. Owens, are you on? I saw Owens earlier. Owens, are you there? If not, we will. Are you there? Okay, good. Okay.
You hear me?
You're on.
Okay. I want to thank you, Senator, for taking up the mantle in this gravest challenge of our time. You came to us first well over 4 months ago, and one of the first leaders to take up this mantle, and we appreciate that. As you know, in the African American communities, the coronavirus has been devastating, and due to different health disparities and economic disparities. So we have some suggestions as to how we could combat this. We need a short-range plan and a long-term commitment to deal with these disparities. One of the short-range plan is to ensure that all people have food security and shelter. Also, we want a dedicated amount of money to go to deal with these disparities that's encompassed in the bills that are passed in the Senate. We also need to look at our undocumented people to stop the spread, to give them a safe place so they won't be afraid to be tested, because from my understanding, that's a real concern because of fear of being deported or discovered, that a lot of documented people aren't being tested. And so this spread of virus just remains. We also need to have free internet for all families with school-aged children, so people in depressed areas or poverty-stricken areas who can't afford internet, children won't fall that much further behind. And we also need to ensure that we have small business loans easily accessible so people can keep your business viable during this time of the pandemic, and also to have for nonprofits to ensure that nonprofits are funded adequately during this time. And these are things I think will help us.
Thank you. We'll get the remainder of your concerns in writing, and thank you so much.
Thank you, Owens. We appreciate it very much. And now we're going to turn to education. With all the uncertainty going into the fall school year, and wanting to hear from them because I know that they're concerned also. First, we're going to hear from Chancellor Sarah Tucker with the West Virginia Higher Education Policy Commission. Sarah, are you on? And Sarah not there right now, we'll go right to Fred Albert with the WV, West Virginia American Federation of Teachers, AFT. Fred,
Thank you,
there?
Senator. Thank you,
Oh,
Senator
Fred.
Manchin.
How are you, Fred?
I appreciate this forum. Thanks to your staff for putting this together. I just want to say before I start, when this started back in March, our educators were given a weekend to get ready for remote instruction. And I agree with Brother Owens Brown, what he just said. We've been saying this for years. We need broadband connection across the state, and that's a must. But I'm sure you have your crystal ball there in front of you, and you're looking into it, and you know all the answers, Senator Manchin. I've been looking into mine, and I can't find the answers, but I will tell you, our educators are very concerned about, they want to go back to school. They want to be face to face with their students. That's what they love doing, and nothing will ever replace that. But it's a scary time right now, and our educators are concerned for themselves, for the service personnel, for our students, and we've got to do everything that we can to make sure they're going back, when they go back, into a safe situation. And we know it's going to take money. We understand that. But if we're going to follow science and the medical recommendations and follow CDC guidelines for wearing masks and all of the precautions we need to take, it's going to take money. And we would just encourage you to do whatever you can. And we thank you for all that you have done. But we need this HEROES Act or some form of it passed in the Senate. And we appreciate all that you're doing to try to help us do that. So those are our needs. There are very many, a lot of concerns out there. But the number one thing is we've got to make sure our kids and our educators are in safe places before they go back to school. Thank you, Senator.
Fred, thank you so much. We have Sarah with us back, but I want to go to Sarah. Are you on? Sarah Tucker?
I am. Can you hear me?
We can hear you, Sarah.
I am. Can you hear me? Okay, great. Thank you, Senator, for this opportunity, and thank you for everything you did for our students in higher education in the last stimulus bill. Our chief concerns right now are the health and safety of our students, faculty, and staff, and ensuring that our students' learning is able to continue in the most effective means possible. We've taken extraordinary measures at great cost to ensure the safety of our campuses. But we would like to continue to request support for COVID testing for our institutions. We also ask for assistance around online learning. Our low-income first-generation rural students are not able to access education. We need it fixed and we need it fast. We can't wait for the middle mile or the last mile to be built. And finally, as the other panelists have mentioned, we have significant revenue losses. Our enrollment and room and board are down. Auxiliary activities have been cut out. We're staring down the possibility of closing multiple colleges this fall. So we'd ask for flexibility in any funding that could be directed to the institutions, particularly to replace lost revenue. Thank you so much again, Senator, and I appreciate you and your staff so much.
Thank you so much, Sarah. I appreciate also your input as always. And now we're going to have Delegate from the West Virginia Education Association. Dale, you there?
Yes, I'm here. Can you hear me?
Yes, sir, buddy.
All right. Well, thank you for getting this together and having this opportunity to speak. First of all, we want to ensure the safety of our students and our educators. That is first and foremost. And it's going to cost money, as Fred said, to do that. The HEROES Act, $175 billion is going to be needed to provide the cleansing, the PPEs, the everything that will be required to get our students back in school. But as I say that, let me assure you that we will not, and I repeat, we will not lose a generation of our students. Our educators will get the students where they need to be, whether it be in person, whether it be virtual, remotely, whatever it takes, we'll get the students there. But as everyone has said, we don't have the broadband capacity, we don't have the ability to reach out to the rural communities in West Virginia that we have to have. So it's vital that we pass some form of the CARE Act, HEROES Act to get the $175 billion into public schools, and that we really look at the broadband issue. And again, thank you all and your staff for putting this together.
Thank you, Dale. Appreciate it very much. Next, we're going to hear from a group that's been providing individuals and communities through the pandemic and beyond. They've done a tremendous job. And first of all, we'll have Jenny Ganaway with the VOAD. Jenny, you there?
Hello, can you hear me?
Sure can.
Hey there. Senator, thank you for bringing us together today and for listening to our concerns. We appreciate you and what you do for West Virginia. West Virginia VOAD and the voluntary organizations is written into the state EOP, Emergency Operations Plan, to help during disasters with response, recovery, and long-term recovery. So setting up shelters, helping with feeding, distribution of supplies during disaster, and then helping families recover is a big part of what we do. We have some funding that is streamlined from our foundations that go to the voluntary organizations. That funding has been redirected to help with COVID, which is going to leave the voluntary organizations at a shortfall in our annual fundraising. And our fundraising strategies has been canceled for the year. What can you do or help do for the voluntary organizations that depend on the financial support from foundations who now has given a lot of their funding to COVID-19 to help us be able to be sustainable and have the funding we need next year when we're faced with flooding?
Well, Jenny, this is the whole thing. Thank you so much for your input, but this is basically why the second round that we're doing right now and why we're having this conversation of those people on the front line that provide so much services that might be left out or may not be adequate enough for them to continue the services that people depend on. So that's why it's good to hear from you, and I can assure you we will be taking your concerns and our interest and concerns in the people being served by your organization. So absolutely on the front of that one. Next, we're going to hear from Margaret O'Neill with the West Virginia 211. Margaret, you there?
Can you hear me?
Yes, we can. Thank you, Margaret.
Thank you, Senator Manchin. You know, we, the United Ways in West Virginia 211 have been active since mid-March and tried very hard to answer the call. When we talked to you and Mara early on, we've since delivered almost 40,000 masks across West Virginia, some made and some purchased. About 25 tons of food distributed through our statewide food drive, and we just stand ready to help any way that we can. Moving forward, I would say to all of our educators and all of you guys who are here at your ready, just tell us what you need. But moving forward in the new bill, we would just ask consideration to 211s across the country. 211s in the United States, there are about 200 of us, have increased about 400% in our calls since the COVID-19 began. 50,000 to 70,000 people per day ask for help with resources like food and utility assistance. And just to sum that up and close, here in West Virginia, almost 10,000 calls since March the 10th to help with utility assistance, food insecurity, and rental assistance. So we, your United Ways are ready to help with distribution. If there are funds available for utility and rental assistance, we have some of our own, but would certainly stand ready to help on any national level. And 211s across the country would certainly appreciate your support. Thank you for all you've done, and we're here if you need us.
Margaret, you all done a great job, and I've depended on you heavily. You know that. Next is Bill Carpenter, West Virginia Senior and Community Services. Bill, you there?
Yes, sir. Can you hear me?
Sure can.
I appreciate the opportunity to be on the panel today. I represent senior providers throughout the state who provide in-home services and, more importantly, the home delivered meals to our seniors. I'd like to echo some of the comments that the other panelists said. We need PPP. We also need streamline for the financial monies that you've been able to get for us. It seems like the red tape is pretty heavy, and you know, our seniors not only care for themselves, but in many cases, due to the opioid crisis in our state, they're caring for grandchildren and great-grandchildren. One of the things that we'd like to see in any additional legislation is money for hot cold trucks and other equipment that have really taken a beating over the last few months. You know, in many cases, we've not had replacements since 2009 when we had a wonderful governor named Manchin. But you know, we're doing the best we can, and unfortunately, it's taken a pandemic to see that funding for senior services is low, both on the federal and state level, and the Older Americans Act has not had any significant funding increases since I've been around in 25 years. So we would appreciate that. And there's another issue that I will send a letter that we'd like you to look into. Is the electronic visit verification that is scheduled to start on January 1st, 2021 in West Virginia. And it's going to put an undue pressure on the in-home providers that we just can't get the training or the equipment or other needs related to that. But I will follow up with a letter. Again, I appreciate you holding this conference, and we appreciate everything you do.
Thank you, Bill. We're fighting for you every day. Let me say, before I go to Jeff Allen, I want to say this. We have our legislators there. I want them to hold on there because we want to hear from them. I'm going to stay on a little bit longer because we're going over right now. We have 5 more presenters, and when we get through the 5, we'll go right to our legislators who have any comments or input on this, if they can. So please hang in there. We'll stay longer to hear from our legislators. So next of all, we have Jeff Allen with West Virginia Council of Churches. Jeff, you there?
I am here. Senator Manchin, thank you, and thank your staff for your leadership and for holding this very well-crafted virtual town hall. The West Virginia Council of Churches supports legislation that strengthens our healthcare system, makes sure that our economy works for our essential workers, and provides a robust and sustainable education system, particularly for those who are vulnerable. Some of the needs that the vulnerable have, some of their supports, are food pantries and banks. Food pantries and food banks, their costs have been increasing as they have tried to get food out. Housing for the homeless, transitional support for persons leaving corrections, support for foster care, adoptive and kinship care families, child care centers who are often reducing their population by half. So they need more support, but there also needs to be more child care centers in the state, and children's education, nutrition, and mental health. We hope that the upcoming CARES bill will provide support for state budgets and jobs such as continuing unemployment benefits. And we also hope that other legislation such as the Reclaim Act, which can provide jobs for persons here in West Virginia, also will receive support and pass. Thank you.
So much. We've always appreciated, Jeff, hearing from you. Next of all, we're going to hear from the groups whose members keep us well informed, and we're going to start with Don Smith, West Virginia Press Association. Don, you still there?
Yes, Senator, can you hear me?
Yes, sir.
Okay, Senator, thanks for this call and for your work in Washington to get the CDC to use local newspapers, radio, and TV, and in West Virginia across the nation to inform the public. In terms of the first go around, that didn't happen at the community level in the initial period. And as you know, there's a real need to inform the local communities about the COVID-related issues. Our newspapers cover and partner with almost everyone on this call. And the crisis has meant extra work, extra precautions for reporters, drivers, and staff. There's a greater need. But the revenue from advertising and from all the related events that these folks are talking about that are canceled is no longer coming to our papers. Many papers benefited from the PPP grants, but the greatest value, we think, would be for the state and federal government to use the newspapers and local media to inform the public. We could actually see closures of newspapers in many areas, and some have closed already. I think newspapers and all media local media will be a key during the crisis, and just as important as the recovery. And without the community newspapers, the recovery will be harder. Anything you can do to encourage the Trump administration and the CDC and at any level to use the papers to inform people would be helpful. Thank you.
Don, thank you so much. Next of all, we have Pat Tolley on behalf of the West Virginia Broadcaster Association.
Okay.
Pat there? If Pat's not there, we will go.
Hello, Senator Manchin. I'm here.
Oh, I'm sorry, Pat.
That's okay. Thank you. Thank you. Thank you for bringing this meeting together, sir. And thank you and Ryan for all of your help to me. I greatly appreciate it. I guess I'm just expounding or need some expounding on the PPP. And if you think there may be another one coming down the pike, myself and my fellow broadcasters are expecting an extremely rough third and fourth quarter due to a lot of the sports that are being canceled. And quite frankly, without some more PPP money, I don't know that I personally can keep 12 employees gainfully employed. So if you could just maybe expound a little bit on what may be coming down the pike as far as the PPA, and if you think it will reach the broadcasters. And another thing too, just to expound on what the gentleman before me spoke about, do you think that radio would be included in some of the COVID money as far as the PSAs that, you know, they are wanting us to get out there?
Let me just say, you know, we got a letter back from the White House, Mr. Booth, on that money being spent now with the press, and I want to make sure that the broadcasters are part of that also. We're checking to make sure, and we will follow up on that, because now to do it, you all done so many PSAs free for all of our benefit, and now we've got to make sure that the government's able to step up to the plate and help you all. So
Thank
we're
you,
on
sir.
that. Okay. Finally, we're going to hear from two organizations representing behavioral health in the state. First of all is Mark Drennan with the Behavioral Health Care Providers Association. Mark, are you there? Mark Drennan with the Behavioral Health Care Providers Association.
Thank you, Senator.
Okay.
How are you? Thanks for this invitation, and thank you for the stimulus that's been passed so far. On PPP, if Congress does plan to expand on that program, we offer that you might consider a revenue cap rather than a specific cap on employees. And this should be constructed in a way to allow nonprofit behavioral health centers to benefit. Many of ours have less than 500 employees, but some had more. And behavioral health is a sort of underfunded industry, so it would really help there. If you've not already, we would request signing the bipartisan letter to Secretary Azar, asking that the Medicare stimulus portal be reopened. We're also a little disappointed that because some of our members bill a small amount of Medicare, that they received less of a Medicaid stimulus. Also, we'd request the federal unemployment insurance for self-insured nonprofits be increased to 100% rather than the current rate of 50%. That would be really helpful. And we've already discussed issues with the $600 unemployment stimulus, and we would support a benefit for essential workers who've continued to work during the pandemic. On the SUD front, it's been reported to me that sometimes some of the stimulus dollars have been used to purchase drugs, fueling the addictions crisis, and overdose deaths are up as a result. Also reported to me just recently is that routine traffic stops by some law enforcement community agencies are down in some communities, and this is allowing drugs to flow unfettered into communities, consequently resulting in one county saw a weekly overdose deaths double. We've discussed already the importance of telehealth, and we're very supportive of that. We especially the telephone access to rural communities without broadband access. But if we could use this time to update the incident to Medicare regulations that require that a service be provided physically face-to-face, that would be welcome. And then two last things is that we believe that children need to be in school physically present, that children need the structure, nutrition, and social interaction that schools provide. Anything that you can do in Congress to reopen schools is appreciated. And lastly, the National Council for Behavioral Health has drafted a relief proposal for the behavioral health industry as a whole. I've had personal input into that, and we ask for your consideration. So thanks again.
Hey, Mark, thank you so much. Great points, and we have taken all of them in. Next of all, we have Joyce Yadlowski. Joyce is with the West Virginia Coalition Against Domestic Violence. Joyce, are you there?
Yes, I am. Thank you, Senator.
Thank you.
Yes, so I'll be quick since I'm last, and I just want to say thank you for the stimulus package that went out before. And what went wrong for us with that is there was $45 million that were allocated through FIPSA for domestic violence programs, and two things went wrong. First of all, we haven't received it yet due to some state bureaucracy. We're promised that we'll get it soon, but it hasn't met the actual licensed programs yet. And when it does get there, it'll be approximately $13,000 per program. And so that leads to what we're asking for next, and that is to continue to provide extra funds for shelters and programs to be able to help the increasing numbers of victims of domestic violence that don't want to stay in unsafe homes. They need places to go. We've had to expand shelters, use hotels, use other community housing issues. So when we get that money, we'll eat through it really quickly. And as you know, the virus is continuing. So as the virus continues, we anticipate a continued increase in families experiencing domestic violence and a continued increase for those funds. So thanks for all that you can do. I sent a letter this morning to you and Senator Capito spelling out the specific needs. Thanks.
Thank you. Thank you so much, Joyce. And let me say thank you to all of you who presented. There's been 43 of you. Everyone's participated with some great input that we take on to DC. We'll be on this. I have state legislators who have been so patiently staying on, listening to all of you. And I'm going to go through the list that was given to me. There's no order to this whatsoever, so I'll go through it. And first of all, I'll go through the state senators. I have Mitch Carmichael, President of the Senate. Mitch, are you still on? If not, we'll go right to Senator Dr. Ron Stallings. Ron, are you on? We have Senator John Unger. See if John's still on. I know they had to wait quite a bit, and they've been so patient.
And I did get a message from Josh Brown.
Yeah, that's the guy I told you.
Yeah. Peer recovery coach. One thing it really gets under my bonnet is peer recovery coach. There's no such thing as a peer recovery coach.
Hold on.
There's a
I'm talking to someone else. Hey, John, is that John Unger?
Because I tell you why. And
Marcus just muted him.
John, this is Joe Manchin. Is that you, John, Senator Unger?
It would be the exact same. So how do we want to label that?
just first of all, there's no designation even in federal.
Okay. Can you all? John's having a conversation in detail, and he always does. He does a very good job too. Also, Senator Richard Lindsay. Richard, are you on? Huh? Are we not unmuting him? Do any of the senators any of the senators are on, if they would unmute and identify, we'd be happy to hear from you.
Senator Stallings is trying to talk. Marcus, if you could unmute him.
We don't have an option to unmute Ron. Is Ron unmuted himself? Senator Stallings? What happened? I don't know. Well, we're having technical problems with our state legislators, and we desperately need to have them involved. Can any of the delegates? Mick Bates, are you on?
Yes, Senator. Can you hear me?
We can hear you fine, Mick. Thank you.
Right. First one update. So just very quickly, and what I've got kind of a strange thing to do. I've got a little visual here. Hopefully, people can see it here. That relates to the CARES Act, and as you can see here, over half that money. Well, first of all, let me say that we've only spent 5% of what you've already sent us. So looking at the auditor's office.
1.25 billion.
Yeah, we've only spent 5%. The 95% of that money, Senator, is still sitting in a bank account, which, as of this morning, the auditor can't locate, and appears not to be invested, just sitting somewhere. So only 1% of that has actually gone out to local governments. About 13 million as of the 13th. $57 million was used to backfill last year's fiscal budget. So the governor proposes to park over half that money into workforce, all right, so that he can use it for future needs. As you know, Senator, you've already provided loans to governments for states for workforce, and we don't need to do that. So what I'm suggesting is you don't send the state of West Virginia any more money until we have a process in place to make sure it's spent the way it's supposed to be spent, and that further funding flexibility be contingent on states and governors establishing a methodology for formal legislative involvement and oversight of existing and future funds. I would also suggest that we structure funds to be pushed out to the fullest extent possible directly to those that need it and not through state governments, and use the private sector and existing federal programs to do that. I think all of us would agree that the PPP program and the SBA program have been very effective. and they've been administered by the private sector and by the federal government. The unemployment program and the CARES program have been a disaster, and they've been administered by the state. So those would be some of my comments, and I thank you for what you and all your staff are doing. So if that's not clear, I'll be happy to follow up with you and others as to that suggestion.
Thanks, Mick. I appreciate it very much. Next, I have Dr. Delegate Erica Storch. Erica, you on? Erica Storch? If not, we have Delegate Amanda E. Step-Burton. Amanda, you on?
Hi, Senator.
Hey, how are we doing? Good.
I'm doing well. How are you?
Thank you.
Thank you for having us. I'm just excited to get to work to protect our hospitals, our hero workers, our small businesses, our large businesses, and most importantly, our students as we talk about school integration. I've got some great tips today, and I just wanted to say thank you for having us.
Well, thank you, Amanda. That's great. I'm just saying, I think it's great for us to hear from the people on depending on. Let me go back to see if there's any of our senators. Richard Lindsay, Senator Lindsay, you on?
Yes, Senator. Can you hear me now?
Sure can, buddy.
All right. Thank you, Senator, for putting this together, and thank you for all the participants for letting us know what you need now and what you need in the future. I mean, I think one thing that if there's a theme that we need to look forward to, that is how do we get our kids back in school safely for our teachers and parents. As a working parent myself, I sympathize with all the working parents who have tried to get through the last several months and taking care of kids and then trying to work at the same time. It's not easy. It's something that needs to be figured out in order to get our state economy and national economy back up on its feet. So I look forward to working with you in that regard. And thank you for everyone who has spoken up.
Senator Lindsay, thank you so much. Is Senator Ron Stallings on? Did we get him back on?
Ron had to hop off, but he wanted to relay this. His response would be invest in birth to 3. Adverse childhood experiences are getting worse, and family resource networks.
Okay. I think we have Delegate Erica Storch. Erica, you there?
Yes, thank you, Senator.
Oh, very. Thanks.
I struggle with technology sometimes.
Trust me, we all do, Erica.
I didn't realize I wasn't connected to the audio. So,
okay.
As you know, I mean, I hear the strife and the pain of a lot of the small businesses in the Northern Panhandle. Our local businesses are struggling, obviously, because of the, our proximity to Pennsylvania and Ohio, and it's been a challenge for all of us. But I mean, I know that nobody has any easy answers, so we'll just keep pulling up our bootstraps and keep trying to do what we can do.
Eric, you still there?
Yeah, I'm here.
Okay.
Actually, start my video now.
That's okay.
I'm just finding it left and right.
There, now we're talking. We got things rocking now. You have anything else you want to add to that?
I mean, so the interesting thing that I have been hearing from several, the challenges they're experiencing with trying to get their people to come back to work. We have several that have been trying to ramp up a workforce, and unfortunately, for the various reasons, they're hearing that they may not feel safe, but the employers are trying to take every effort that they can to make sure that they are as safe as possible when they are working. But with the increased pandemic unemployment that has been distributed to those participating within the unemployment system right now, it's creating challenges to those that want to open their businesses.
We're on top of that. We know it was a challenge, we hope we can fix it. We have Delegate Doug Scaff, I believe. Delegate Scaff, are you on?
Yeah, thank you, Senator. Appreciate you having us. I echo what Delegate Storch says. It's real. I mean, being someone who has rents to a lot of small businesses out there, I mean, from the restaurant industry all the way down to construction industry, it's just finding people to come out and work. So I say, please, 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 whatever you can do to encourage people to go back to work.
Yeah.
And let's incentivize them when they go back to work and they are working for it and putting money back into the economy. I think that's number one. But number two, I really can't state enough, as you stated numerous times, is this ridiculous nonsense of not letting the legislators come back and at least talk about the future of dealing with this pandemic. It's uncalled for, it's unprecedented, it's ridiculous, and it's just this lack of disrespect for all of us eyes and ears. That's what we're elected for. And so anything you can continue to do to put the hammer down and just go directly to, like many people spoke today about, directly to the cities and the counties and the towns and to the small businesses, I think those are working well. I don't have a nice graph like Delegate Mick Bates did, but I concur that, you know, people want to get reopened and get back to normal. But the thing that we're concerned with the schools is if we could designate some of that 1.25 to test our students every couple of weeks, if we decide to go to a type of schooling, and I'd love to see the students go back, but we should designate at least $100 million to test our faculty, our staff, everybody within the education community, to ensure that our students and those that work are safe.
Well, Doug, I appreciate very much the input there. I can just tell you the state, and in Washington, we're having the same problems because a lot of the authority has gone with the executive branch for the president's office, and then some of the leadership, but it's not really to the rank and file as far as the state senator, the U.S. senators or the Congress people. It's up to all of us to take it back. The Constitution is very clear: 3 separation of powers, 3 equal branches of government, and the legislative branch is the financial branch of government. You must be involved because your ear is supposed to be to the ground, talking to constituents. Keep fighting and speaking out, Democrats, Republicans, Independents. It's our responsibility as elected officials to make sure we're able to represent our people. Next of all, I think I have Cindy Lavender Bowe. Delegate Bowe, are you on? Delegate Bowe? Okay, if not, we'll go to Delegate Sean Fluharty. Sean, are you still on?
Senator, yes.
Hey, good, Sean.
Thank you for your leadership during this time. I enjoy having you in Washington, but right now I wish you were in Charleston, because we could certainly use you there. Terry, I think he just took what I was going to say, and that's the fact that I think this meeting is illustrative of the necessity of the legislative branch to be involved, because we have the ability to have our ears and eyes on the streets and the communities that we represent, more so than the governor does from the executive branch and from his office when he is there every now and then. And I look forward to hearing from you as we go forward, because as Delegate Bates had his little green screen there, he sounded very angry, and I don't blame him, because we should be angry by now of what's going on. And we've been inundated with emails and phone calls about just the dire straits that West Virginians are in right now. And to have this money essentially sitting there unspent and allowing the governor to use it as simply his monopoly money, and we know what he's doing with it in an election year, and not using it for the dire needs of West Virginians. It needs to be addressed, and I hope to have your voice going forward, and the voices of many who are on this call today, because you're the leaders in the community in the many areas that we look as legislators look to you for leadership. So thank you for the time today, and Senator, I hope that you're playing some good team ball going forward when it comes to this situation.
Thanks, Delegate Fluharty. I appreciate it very much. Next, we're going to go to Delegate Barbara Fleshauer in Montague County. Barb, you there?
Can you hear me?
Sure can now.
Okay, great. I want to echo what people are saying. Thank you. This is way more than we have gotten from the governor's office, caring about what we think. And also, we've been really educated by hearing all the speakers that you had. This was very, very helpful. So please share your appreciation to your staff, and thank you for wanting to do this, to use your time this way. We feel very, very flattered. 2 issues I would like to bring up. One is clarity on payment for testing, and that includes payment for when people have to get tested twice. Like if you think you've been exposed at a grocery store, what will happen there? And insurance companies are not clear on that, and whether you have to have symptoms to get paid. I understand that PEIA has said they will not pay unless there's symptoms. So if there could be some clarity on that, that would be a good thing. And then the second thing is just broadband. I mean, as much as our president is saying that kids have to be in school in the fall, and we know that that's not going to happen everywhere. I'm just so worried about kids losing a whole school year. So again, I want to say thank you. And I especially appreciate your sticking up for the Constitution and all three branches of government being involved. Thank you so much for speaking out about that.
We've got a fight right now. I can tell you, we've all got to fight in order to protect democracy. That's for sure. Next of all, we have Delegate Linville. Delegate, are you there?
Thank you, Senator. Can you hear me?
Yes, sure can, Dan. Thank you.
Thank you, sir. I'd like to echo some comments about broadband primarily, and I'd like to come to you with a relatively specific ask. Sure. There are a number of hindrances from a federal level, from a regulatory standpoint, that have delayed broadband projects in the state of West Virginia to a large extent. And in the crisis that we're in right now, very specifically, there are categorical exclusions or exemptions from the National Historic Preservation Act or the National Environmental Protection Act that are in place and are supposed to apply to broadband, but very often do not. And so if you were trying to run broadband fiber in a 3-inch wide by 8-inch deep trench, as a for instance, in some instances, if it hasn't been surveyed before, even along a state right-of-way, so right along a road, there may be the potential that you have to, for tens of miles or longer, have to have an archaeologist come out and dig down 4 feet deep by hand prior to approval of a project. And very often what we're finding is that it's not so much that there's an unwillingness to do a project. It's not so much that there's an unwillingness to serve an area, but that the delays and the cost and the expense there are incredibly high. And so as new legislation is put forward, if there could be some clarity in what categorizes an automatic exclusion in a piece of land, as a for instance, that has previously had steamrollers rolling over it, and soil compaction and things of that nature, that would be incredibly helpful in actually deploying the capital that is out there for broadband. And in addition to that, I would ask very specifically that there be some sort of an incentive for cellular providers to provide true, unlimited, and unthrottled cellular broadband access to folks. What we see very often with some of the major carriers is, a 15 gigabit or gigabyte rather limit, after which time it slows down to dial-up speeds, and they call that unlimited. And quite frankly, that's not. And so, if our goal is to serve the economy, to serve the students, to serve the teachers that are needing this, and everyone else that's much more highly reliant now on broadband than previously, there must be action be taken on a federal level. These are things we cannot do on a state level, which would get this done in a quick fashion. And so that would be my very specific request.
Thank you, Delegate Linville. I appreciate it very much. How about Delegate Bill Hartman? Is Bill, you still there? Okay. How about if we go to Delegate John Mant? John was on, I know, before. Is John still there? We're having a hard time unmuting Delegate Mant. He's on, but you can't get him unmuted. John, the voice is going to have to come from your end. We don't have control here from yours. We'll go to Delegate Danielle Walker. And John, if you can get unmuted, come back.
Good afternoon, everyone. Can you hear me?
We got you, Danielle. We got you.
All right. So you know what my first concern is, and I called on you in the beginning of this, Senator Manchin. We need direct funds to the minority community, especially the Black community here in West Virginia. The numbers of disparities is real. And so we need direct funding from the CARES Act to go directly to the Black communities. And we can speak to this off of this call because we need to know exactly who is coming through. Because legislatively, the governor is just sleeping. The next thing, we need to extend the Birth to 3 program, especially since we don't know what's going on in schools.
The question on that, are you talking about especially on the testing?
We need testing, we need education, we need different forms because the Black community has a different culture than any other community.
Okay.
Also, we need
to know how I can help. That's all.
Yes, sir. Extend Birth to 3 to maybe to the age of 4.
Right.
Because we have schools that we don't know what's going to go on with school. And if someone is so concerned with that extra $600 with unemployment, we need to look about raising minimum wage. We need a livable wage, especially in the state of West Virginia. You want to build the economy, you build the people, and you put West Virginians first. Also, according to free internet, if that family has already had a bill or an account with, let's say, Comcast, and that account is not in good standings, they are not eligible for free internet. So we need to work around this. And we need transitional services, especially for people that are moving from one place to another. We need to make sure that we have Medicaid available and it's not a 30-day wait. People need insurance and they need it now, especially if someone has lost their job and they need insulin. And we need a moratorium on expulsions, suspensions, evictions, and insurance increases. Not every area in West Virginia has public transportation, so we need some vouchers where people can use something or somebody, whether it's Lyft or Uber. And as far as SSI and disability, when it comes up for these people to do their yearly or their transition, let's say you have a child who's had survivor's benefits, but they are of age right now and they need to go into regular disability, that person should not be forced to go inpatient to see a physician when we're using telehealth all around. That's all I have. Thank you, Senator.
Danielle, thank you for the great input. Senator John Unger now. John's not back. I don't think he is. We can't get him.
No, John had to jump off, Senator.
Okay. How about Delegate Rodney Miller?
Thanks again, Senator, for having us. I'm going to run through some things real quick. First off, I can't reiterate any stronger what my colleagues have said in regard to the legislature having the need to come back in and do our job, if you will, to help with the expenditure of that money. And I'm going to preach to the choir just a little bit. One of the things that's very obvious as we were going through this, and we've had callers from all over the state of West Virginia here today, and there's one common phrase from just about everybody that's participated is, can you hear me or see me? I'm having problems with my internet. Everybody that's been on here all over the state, and if we're going to go back into the education process, I mean, whatever form it is, we've got areas that are in not just desperate need. It's beyond that, and we're not going to be able to educate our children if we go into some kind of blended concept with our education. So broadband is huge. Small businesses need more help because of the lockdown, and instead of trying to go through some cumbersome system at the state level, that they're having even issues that they can't even find out what they're eligible for, let alone to navigate and apply for where we're at. So we're having problems with that. Some cities have tax issues, so they don't qualify for federal grants. They're being held down. More money into the CARES Act to our small businesses, where our big businesses may be sucking up most of that funding. So we've got to take care of our small businesses. Well, for future monies, better guidance and actually fund projects related to the response and recovery, maybe better guidance or more specific guidance to the states for the problems directly related to the issue, not funding things like road projects. We can't just go off the reservation, so to speak, and then be down the road, whether it's a small municipality, a large municipality, a county, or wherever, try to do the best they can and navigating through these murky waters, and then get tagged later on with a massive bill, whether it's the state even having to repay this to the federal government because we haven't done things right, because we don't have anyone with the hand on the wheel right now to navigate us through this. So there's a lot of problems that we could go into that we probably don't have enough time for me to even go into.
Rodney, I appreciate the input. We have Delegate Evan Worrell. Is Evan on?
Yeah, thank you, Senator. This is Evan Worrell. I appreciate the opportunity to speak with you.
Appreciate it.
Yeah, I just want to focus. I could focus on a lot of things. I want to focus on PPE. We talk about PPE getting all the way down to the levels of even our volunteer and full-time firefighters as well. We talk about frontline workers. I know that's a big issue. And so compounding on that, we have another PPE issue going back to school. Our teachers, service personnel. I mean, these are parents. These are people who take care of their own children, their elderly loved ones, whatever the case may be. And how are we going to get PPE to them? And I think we have a governor sitting right now on hundreds of millions of dollars that we can utilize to get on the front lines, and that's not happening. So through this next round, I don't know what the ramifications are, how you work around it, but we need to get PPE down to frontline workers, including those educational people as well. Thank you, Senator. I appreciate that.
Well, thanks, Evan. Thanks for waiting. I appreciate it very much. Delegate Ed Evans, is Ed on? Ed, you there? If not, we'll go to Delegate Phil DeSterio. Phil, you there?
Yes, I'm here, Senator. Thank you.
Great, buddy. Great, thank you.
Thank you for hosting this for everyone, not just for my colleagues, but for everyone that's here today. And, you know, it's late in the day, getting late in the day. We've been here for a long time. I think that everyone has brought legitimate points up that I'm ready to come to Charleston and work with. So I'm going to take my little bit of time right now to say hello to you and hello to all my colleagues that I've not seen. And I want to get back together with you and get to work. And it's really tough to call Danielle Walker. So thanks for that opportunity, Senator.
Oh, thanks, Phil. Appreciate it. How about Delegate Evan Hansen? Evan, you on?
Hey, thank you, Senator. I'm one of the delegates, along with many on this call, who have written a letter to the governor to call a special session so that we can properly oversee that $1.2 billion, but that doesn't seem to be happening. We're going to have to go to Plan B on that. In terms of issues, there are so many raised by constituents. One is certainly related to small businesses. There's now $5,000 being made available through the money sitting at the state level for supporting small businesses, and that's nothing. You know, we've got some big issues here, especially in Mon County with bars and restaurants, since we're a hot spot now, and that $5,000 is not even going to keep a business open for a week. So we need some additional support there. The second issue is broadband, and this has been talked about a lot related to telehealth and K through 12, but it's also a big deal for UVU and institutions of higher education so that they can do proper education. And then the last issue I wanted to bring up has not been brought up yet, but it's federal support for vote by mail or vote at home. You know, we had a partial experiment with that in the primary election, and it went very well in West Virginia. There are several states that have true vote by mail programs, blue and red states, and vote by mail would do very well in West Virginia. The reasons why West Virginians don't go to the polls are because they're sick or have disabilities, or they have transportation problems, or they have conflicts with work or school. Those are all things that can be addressed by vote by mail. So I hope that that can be included as well. Thank you.
Evan, thanks for the great input. I have two here. I got Delegate Chad Lovejoy first, and then I'll have Senator Charlie Clements second. So Chad, you there?
Yes. Can you hear me, Senator?
Go ahead, buddy.
Okay, I'm going to be brief and just raise an issue that we haven't talked too much about. That's food insecurity. We have, our two food banks, Mountaineer and Facing Hunger, covering the state of West Virginia. Both of them tell me they're up 35 to 45% in terms of need. Before the pandemic, we were at 15.3% food insecurity. That obviously has increased. We've had help with the National Guard. I think they prepared and served about 330,000 meals through June. But on the federal side, and I know you've done a lot of good work, and I appreciate that, the PEBT program, increasing SNAP, the FEMA, I think we got 300,000 meals. But as you go forward, just as you always do, please keep in mind the most vulnerable of our population, which is way, way too many who are relying on these programs, both in terms of continuing them and potentially increasing them in order to stay alive. So I just hope that as we go forward, you'll keep that in mind, as you always do. And I thank you for your leadership.
Chad, thank you so much. Thank you for the input. Senator Charlie Clements. Charlie there? Charlie still with us? Okay, we're going to try Delegate John Mant again. John, we have you this time? We're trying, buddy. Can we get John unmuted? John, we can't unmute you. You're controlling your own voice from your end if you can. I'm so sorry. Do we have any delegate or any senator still on that wishes to speak?
Okay, can you hear me now?
Yeah, is that John?
Yes, it is.
John, we got you, John.
You know, when I was in college, we didn't have the internet, so my cup and string can only reach so far with this forum we're doing. I'm sorry?
I'm envious. At least you got back on. I might not have never got on.
I did, and thank you for your help. And I want to thank you for hosting this forum. And it's been very informative, especially as a state legislator. Very informative. And we need more of this. If we can't meet in Charleston, we need more of this right now. So we can share our thoughts and ideas and how we feel. A couple of things for small business that I would like to touch base on with the Paycheck Protection Plan.
Okay.
Is I hope there would be a way that we could possibly, and I've heard this from a lot of businesses, there are unemployment costs, workers' compensation costs, are the company's Social Security taxes, Medicare. When you add those percentages up, even though businesses can be open and some of them can only seat or host 50% or less of their maximum, they still have those percentages that they need to pay, and it's very tough for them to continue to stay in business and to continue the hours. So I just wanted to touch base on that and a couple of things that I heard. Well, let me stay with the PPP. I have seen and heard some of abuses in that. Is there a way that we can have some penalties in there for people that abuse the payroll protection plan? Because there are a lot of people that need it. And then one other thing, and I'll be done. We need help for people that own buildings and rent or lease spaces. Those businesses that they have a financial stake in it where they've built something, and then they hope to fill it, and then they lease it out, and then these businesses go out, and now they have empty space, and they still have payments to make to a bank. So those are just a couple of my concerns and issues that I've heard from around our Cabell County here and around the state. But again, I want to thank you for doing this. It's been extremely helpful and informative. And please tell your wife, Gail, that I said hello.
Donna, I'll do that. Let me just say this. For anybody that believes that from the PPP that believe that they might have scammed the system, the Inspector General will be going through this with a fine-tooth comb, and all of us will. It might be a little bit later, but if someone's done it, we'll catch it.
Right.
Next of all, Senator Clements, Charlie, did you get back? We have Senator Clements, Charlie Clements.
I'm still here.
Hey, I'm so sorry, Charlie. We want to hear from you.
Well, it was my fault. I hit the wrong button on the computer.
That's all right, buddy. We got you now, Charlie. What you got?
It's been an interesting 2 hours, Senator, just listening to what everybody's concerned and thing is. But you know me, I've always been a big infrastructure person. And I definitely think that we need to take a hard look at really progressing with our broadband. Where we talk about our education system and we talk about our telehealth. We're a rural state. And a lot of my district, the 2nd district, they have no broadband. And a lot of the students that have to go to distance learning have to drive to the school to get on to the Wi-Fi that they have there. So I think a big emphasis, we need to look at broadband and of course all the other problems that we've got in the state working with this COVID. It's the worst situation I think I've ever seen. Thank you so much for hosting this.
I can tell you that broadband is the hardest thing that we have going right now. We're fighting for that. There's $1 billion being sent out. Someone needs to go on mute there. Young guys. Delegate Ed Evans. Ed, are you back with us? My buddy Ed Evans from way down south in the free state of McDowell. Is he there? Hey, Eddie, we cannot unmute you, buddy. If you can handle your hand on the volume, there's got to be a computer button somewhere that'll unmute you. We have he's on, but we can't get him unmuted. Right. Huh? Enable his audio. Enable your audio. If it says enable your audio, they're telling me if you hit the enable your audio, that should get you back on. Ed, we can't get you, buddy. We're trying. We'd love to hear from you. You work hard, and I appreciate everything you do. Thank you, Ed. So sorry. Anybody else, any delegate, any senator that might have come on that wants to say something before we sign off? Have we heard from everybody that would like to be heard from? I want to thank everybody for participating, especially all of our presenters today. They did an excellent job of laying it out, what hasn't worked, what needs to happen for it to work better, and we're going to do everything we can to carry that message. We're hopefully to keep these alive here. We want to hear from everybody and stay on top of this until we get this COVID-19 behind us. Don't know when that'll be. We think until we get a vaccine or an antibody, it's going to be hard to get back to what we would consider a normal. And I don't think that we'll ever see a normal that we had before. It'll be a new normal, and hopefully we can make it as good, if not better. Thank each and every one of you. God bless you and be safe. Thank you.